you've been getting, but now I'm glad to meet you in person, face to face, as much as we can. I joined NAC about a year ago, but I just recently started working with Grace on membership, so I'll be kind of the face that you see now in your emails and when we're doing member webinars. So I have, here's the discussion agenda for the day, and I have a couple of housekeeping announcements to tell you all. The first I wanted to let you know is that this session will be recorded, so I'll start that right now. Oh, it's already been started. So the session is being recorded. Please keep that in mind when you're speaking. If you say anything that you realize you'd rather not have in a public video, then just let us know and we can put that out. NAC has started our summer hours. So from Monday to Thursday, we're working from the regular 9 to 5, but on Friday, we're only going to be 9 to 1. We'll be closed after 1 on Fridays. We do have a new website that was launched at the beginning of May. If you had a chance to check it out, it's really gorgeous. If you haven't, it's at caregiving.org. We are starting to implement some new things that will give you special access to members.
Lauren?
Yes.
Hey, it's Kathy Jackson. I'm so sorry. Everybody mute, because I'm hearing background, but also you keep coming in and out. I mean, and if it's just mine, then I apologize, but I hear you and then I don't hear you.
No, I hear the same.
Let me know if that happens again. Okay, good. So quick recap around summer hours. So regular hours, 9 to 5, Monday through Thursday, and then 9 to 1 on Fridays. We have a new website that was launched in May. If you haven't checked it out yet, it's caregiving.org. We're starting to implement some back-end features for members so that you'll be able to go into a new member portal, interact with one another, maybe see some of our research. We're still trying to figure out the specifics of what's going to happen, but would love to hear any ideas that maybe you had as well that would help you better interact with us. We're also starting to implement an ambassadorship program for members. So we're going to start matching members up with employees here at NAC that can best help them. They'll basically act as the liaison between you and NAC. We sent out a survey a couple of months ago that I can send out again. Taking that survey helps us figure out who would be best to match you with and who would be best for you to bring collaboration ideas and projects to as we get that off the ground. And then since we're going into the second quarter, you might start seeing emails from Pat about membership dues. So just make sure to keep a lookout for that and communicate with her about paying dues. All right, so next we had a couple of members join us recently that we would love to introduce to you. They can introduce themselves, but we had Otska, Takeda, and Signa come and join us these past couple of months. So is Katie Danini from Otska here? She was going to give us a few words about the company. Okay, if not, we can move on. I think I saw Stacy Poole from Takeda.
Hi, how is everybody? This is Stacy Poole. Yes, it's Takeda. Actually, there is a airbag company called Takeda. But we are Takeda, and I'm so glad to be here and appreciate being a member of this organization. Takeda is a global pharmaceutical company with a very long history. We were founded in Japan well over 230 years ago, so quite old. You may have heard that about a year and a half ago, we acquired Shire and nearly doubled in size with that acquisition. And our focus therapeutically is on oncology, gastroenterology, hematology, neurology, immunology, and we within that portfolio have many rare diseases. And we also have a vaccines division as well. So a lot going on. I'm specifically engaged in gastroenterology, but I have colleagues who peers of mine who work in the other therapeutic areas. And as you can tell from those focus areas, caregivers are definitely a major part of that constituency in those disease areas. So I don't know if that's enough for now, but hopefully gives you an idea. I'm based here in Maryland, and I'm, again, very happy to be on the call.
Thank you. We're so excited to have you join us and be here at the first member webinar. Brandon Knuckles from Cigna, are you here to introduce yourself?
I am here. Yeah, hey everyone. My name is Brandon Knuckles. I work for Cigna. Many of you probably know Cigna is a global health services company. We have a lot of, in some of the areas that I work in, are a lot of integrated clinical health programs, consumer engagement programs, behavioral health programs, and we've been, involved in the caregiver space for a handful of years now, and really think it's just such a huge opportunity to help support, the many caregivers that are out there and all that they do. And even, as we're kind of living through this pandemic, I think it's just more and more, there's just going to be this need for just a lot of support across the caregiver spectrum. So really excited to be part of the organization here and participate in these webinars as well as the other programs.
Great, thank you for joining us. And I'll give Katie one more chance. She might have come in. No, all right, we will move on. Next,
Lauren. Hi, it's Lily from AstraZeneca.
oh, hi, Lily.
Did you want me to
Go
introduce
for
myself?
it.
Yeah, you can go ahead.
Lily, yeah.
Yes, Lily's super
I
easy.
realized I didn't tell you that I was definitely going to be on the call, so I wanted to make sure you knew I was here.
Hello.
And there's actually a lot of folks on the line. Yeah, so I'm Lily Capuletti, and I am happy to be joining from AstraZeneca. We're also a global pharmaceutical company. We joined just in the past couple of weeks, so we're excited to be a new member. I work in Philadelphia. Our North American headquarters are here in Wilmington, Delaware, and we have folks on my team that work in oncology, respiratory, asthma, and COPD are the main focus areas there, cardiovascular disease and diabetes, as well as an emerging portfolio in immunology, a focus on lupus right now. So we have been doing a number of things kind of on a not as coordinated a basis as it could be, I would say, to support caregivers across all of the many disease areas where we have a presence. And we're looking forward to kind of pulling all of that together and thinking holistically about how we support caregivers as an important stakeholder moving forward across all of the areas where we do work.
Great, thank you, Lily, and thank you for joining us. And then I also wanted to mention that we do have a member of the board on call. So Jim Murphy from Ageless Innovation is here, and he's here. Welcome, Jim. Thank you for joining us. We're going to move on to our mission moment, which we did at our last member meeting, which went really well. My colleague, Charlotte Davison, is here to talk about her work with the Claire Foundation and IBD.
Thanks, Lauren. Hi, everyone. I started out at NAC about a year and a half ago, or almost 2 years ago, actually, as an intern. And in January, I started out in a new role as a program associate. And one of the first projects I was given to work on was in developing some new resources specifically for providers and professionals based on our 2019 study on caregivers of individuals with inflammatory bowel disease. So what came out of this project, I'll talk a little bit about this afterwards, was a guidebook and a guidebook for professionals to help them engage with patients and caregivers, as well as a flyer with resources for caregivers. But the first part of this project was actually interviewing doctors. And I'm super intimidated by doctors. I don't know why. I think some people can probably relate, but when I found out I'd be interviewing them, I was super nervous. And one of my colleagues, Gabriella, told me that I should probably start out with interviewing the patient and caregiver advocates, just to gain my confidence a little bit before heading into those super intimidating interviews. So I did that. I followed her advice and I started interviewing and getting some information from some patient advocates and caregivers. And hearing their stories made me realize the position I was in actually helping them and elevating their voices and making a difference in the doctor's office, because I'm not the only one intimidated by doctors. When IBD patients, especially if they're a child or an adolescent, it's difficult for them, or can be difficult for them to communicate their experience. And I really wanted to express the fact that it's important for doctors to engage both the patient and caregiver in their care and on their care journey. So once I realized that I had the ability to actually make a change, I was super inspired. I was less nervous when I met up with the doctors. And when I was writing the guidebook and the flyer, I was just inspired. And when we presented the flyer and the guidebook in a webinar, which you can actually watch on our YouTube channel, one individual wrote out this comment, which I was super appreciative of, and seeing it reaffirmed the feeling that I had of making a change and a difference. And it inspired me to continue to work to support caregivers and patients. And I just wanted to mention one more thing that, Lauren, can you go to the next slide? Sorry. You can go actually see these resources. They're now available online on our website at caregiving.org/IBD. And with the help of doctors and patient advocates and caregivers, we were able to put these together. And I think that they're helpful, and we've got some great feedback from people, and feel free to share and distribute them. Again, they're on our website, caregiving.org/IBD. Thank you. Thanks everyone for coming today.
Charlotte, one thing I would just add that's unique about the provider guide is we included a list of CPT codes for physicians who may be trying to figure out how could I cover family support, or where does that fit in. So I just want to open it up and see if anybody has any questions for Charlotte or comments. Well, we are always available if you guys do have questions or comments about stuff like this. And Charlotte is also the brilliant mind behind our This Week in Caregiving publication. So you can always reply to that and ask questions there as well.
Yeah.
Hey, Grace, this is Stacy Poole and Takeda. Sorry, I was a little slow to the button. But just thank you for the work on IBD as a company that's focused in this space. And as a patient myself, I really, really appreciate this work.
Yes, thank you.
And Grace, this is Kathy again. Yeah, I think this is awesome that you guys are directing people, caregivers, and anybody that comes to your website to different kinds of resources, and it's just a really value. And I have worked in the field of chronic pain for a long time, so a lot of these conditions have chronic pains. There's a lot of stuff going on in that space, and a lot of the support that you can provide is just so important. So kudos, nice job.
Thank you.
Thanks.
All right. So I'm gonna steal the reins for a minute from Lauren. And Lauren, thank you for getting us kicked off to such a great start. I got a note from Jim Murphy, who's on our board. I didn't know if Jim or if there are other board members, if anybody wanted to say hello briefly before I give a quick update on what we've been working on.
Hi, this is Jim. Yeah, I'm pleased to join the call. In addition to all the board conversations that have been occurring and keeping up with the weekly correspondence and other updates, I just wanted to drop in and hear a little of the dialogue, as I know that I think that caregiving has an even monumentally more important role in the midst of COVID-19, and a lot of the conversations that I've been having with various different partners and customers, it's really magnified that. So Grace, as we talked about in recent board conversations, you know, very excited about the release of caregiving in the U.S. and I think that being able to be an important voice in caregiving as the Alliance has been for decades now, is even more important today. So really just appreciate the meetings and gonna listen out for the dialogue. Thank you.
Yeah, thank you, Jim. So I want to do two things. I want to talk a little bit about our new report, but I'm not gonna go too much in detail because we have a number of resources online available to you. And we also had the good fortune of being able to be interviewed by PBS NewsHour and Judy Woodruff, who herself is a caregiving champion. So I'm going to walk through a couple of data points from this study that I think are particularly relevant in light of COVID-19. And then I'm going to talk a little bit about what we're doing around COVID-19, but I mostly want to hear from you guys. So Lauren, if you'll go to the next slide. So the big picture, big takeaway, and if you're not familiar with this study, this is our signature research study that we've done since 1997. We did additional versions of the report in 2004, 2009, and 2015. And what's unique about this version is that it trends the analysis comparing what's different today than when we last looked at this 5 years ago. So top line, the biggest thing that's different, number one, there's just more people providing care, 9.5 million more people providing care. When we look at those folks, we know that they're caring longer for an average of 4.5 years, and they're more likely to be caring for 2 or more people. So you can see that caregivers are kind of getting squeezed as America gets older and as the years go on. The other thing I would just say is we're talking about 53 million people who are caring for someone of any age. And then our report focuses in on the 48 million who care for an adult, someone who's 18 or older. In that bucket of people, the most surprising thing I think about our prevalence is that there were about 3.5 million families that had a child under 18 who was also providing care. So this is something that doesn't just impact one person, it impacts a lot of people and everybody in your family unit, your community, and your society. If you go to the next slide, there's a couple, and I'll pause there. I don't know if somebody wanted to ask a question. I'll also just say, I know everybody's probably a Zoom pro right now, and you've probably hosted a number of Zoom parties and whatnot. You're welcome to, as we go along, if there's something that resonates with you, you're welcome to use one of your reaction emojis or to pop up, you know, raise your hand, so to speak, on the Zoom, in case there's something you do want to say, because we don't want to miss your invaluable input. So I'm just going to focus in on 3 things I think are particularly important in terms of action items. One of the action items that came out of this study, again, a nationally representative survey of 1,400 caregivers, is just the need to engage in more conversations with healthcare providers. So we've asked this question year after year. Has someone asked you what you need to care for yourself? And have they asked you what you need to help care for the care recipient? So about 1/3 said yes. They were asked by a professional what they need to help care for the care recipient. but there's actually less people in this study than when we looked at this in 2015 that had a doctor, nurse, or social worker ask what they needed to care for themselves. So that self-care piece is increasingly important. On the next slide is the second big takeaway, which is related to that. So the first one is really, we need to think about that integration with healthcare systems. The second is encouraging self-care. So another trend that we saw was that more caregivers said that their health was fair or poor compared to when we looked at this back in 2015. And again, this is for those of you who are public health nerds like us at NAC, you know, self-reported health is correlated with someone's actual health outcomes. And so it's challenging to see that caregivers are saying more and more that they're in fair or poor health. And on the third slide here, the other big takeaway that surprised me was thinking about trusted sources of information. So a lot of efforts focus in on disseminating information to families through social media and word of mouth. But one of the things that stood out to me was when you look at where people get information, particularly where families get information, they're getting that information through a doctor or healthcare professional who's well trusted, through friends and family members, and through care facilities. And then you can see social media and government agencies down here in the 20% range. So what that tells me is, again, that piece about building systems that can better invite in the caregiver, provide education, provide training, is really important to thinking about how we best leverage caregivers as care partners and protect their own health and well-being. So let's go to the next slide. So let's back up one. I'm just going to pause there and see if there's any initial questions about caregiving in the US, anything else people want to ask about before we jump into the discussion about COVID-19.
Grace, it's Sheila Talafas. I'm kind of surprised at this, that the organizations like advocacy groups are not a little higher on the list, but I'm used to working in specific disease state areas. So I think it would be great to see that number go up and people know about the good work that your organization does.
Yeah, thank you, Sheila. I think, you know, what's interesting is when we've done studies, you know, in mental health and in rare disease, those numbers were higher. And I think that's because of the lack of information that healthcare providers may be offering. But I also wonder when I look at this, if there's opportunities for healthcare professionals who may be already thinking, gosh, I don't know how to deal with this, or, you know, I'm not a social worker, or that kind of thing, to be able to partner those folks up with community-based resources. And I know some of our partners on the line, you know, who work on managed care in particular have been thinking through how do we better partner that up. Other comments, thoughts, or questions?
Oh my God, I spelled it incorrectly. Email address? Oh, email, did you say?
So no other thoughts or questions. Like I said, there's a lot of resources about this online. The other thing that we're happy to do for any of our members is to share information or to have conversations with you about what parts of this report might make sense or be specific to groups that you're working with. So let us know if there are things that you want to take a second look at when it comes to caregiving in the US. So let's go on to the next slide. So we're going to talk about COVID-19 and what we've been thinking about. And I have to give a shout out to the Gerontological Society of America, because GSA had come to us and said, you know, essentially that they were grappling with these issues of how do caregivers fit in to COVID-19. So we're going to talk through this draft framework. I want to hear what you guys think. This is not the last time we're going to talk about it. So if you're looking at that and you're like, oh my gosh, is this about to roll out? The answer is no. It's been initially introduced to our board. We've had a conversation with our research collaborative, which is a group of about 40 researchers across the lifespan who will meet again today to do some additional sort of workshopping of the framework. And then we'll be holding an innovation collaborative meeting, which is of our innovation working group and our advocacy working group. So it's going to go through a couple more rounds of review. And then what we would like to do is put it out, release it to the website, and include a list of resources and other information that can kind of help centralize what comes out of this. So let's go to the next slide. That just a reminder of your amazing discussion tools. You've got the thumbs up if you agree or something is resonating, clapping. If there's something you want to share but you're feeling shy, you're welcome to send it to me in the Zoom chat. And you also have options if you look under the participants tab where you can raise your hand, you can say yes, no, go slower, go faster, or indicate that you're taking a coffee break, which is kind of neat. So let's go to the next slide. So this is the purpose of the framework. We want to describe the impact of COVID-19 on family caregivers. And in describing that, we then want to work with you, our member organizations, with other key stakeholders to develop evidence-informed tools, such as tip sheets, flyers, and website information. And we're looking at two particular scenarios. People who are co-resident, but cannot go to a facility or be present with someone because of risk of contagion. Let me just pause real quick. Lauren, are you picking up background noise?
Yeah.
Okay, let's see. They'll give me 1 second to. Okay.
They're definitely gonna need me for whatever.
Okay. So people who are co-resident but cannot go to a facility because they may be there's a fear that that caregiver is going to create contagion, or people who are physically distanced. So they're not in the same place as the person, but they want to be incentivized to stay at home. Then the idea is with this framework and this list of tools and resources that we can arm federal, state, and local policymakers with a better understanding of what caregivers need, where they can be helpful partners, what types of resources are available, and where there may be gaps where a private sector organization should step in, whether it's an employer or an innovator, and where there might be a need for the government to act. So an example of that would be in the new COVID-19 legislation, the Families First Coronavirus Response Act. That act provides paid family leave and paid sick days. But if I'm caring for someone, let's say someone with dementia, and that person can no longer go to an adult day center because that center is closed due to COVID-19, I would not get employment protections under that piece of legislation. So part of the purpose of this is to really peel back some of those gaps to better equip us as advocates to address the need. Any questions about how the framework will be used before we chat about it? Okay. All right, on to the next slide. So this is, you may have to make this bigger. I will tell you guys, I am blind as a bat. So, you may want to maximize your screen. So this is the first piece of this. This is really looking at sort of the use case of what are caregivers going through. And so what we want are reactions, and everything is open here. So the idea here is, do we understand how people move through the healthcare system? So what you'll see is up in the dark blue box, that's the main problem or illness that requires care. You'll see in these light blue boxes, these are just the general needs that caregivers have, that all caregivers have when it comes to COVID-19. Then in the red box, these are additional needs that a caregiver might have because they may be co-resident with the person who's receiving care. And then in the green box, you'll see additional issues that might be present if someone has mental and behavioral health issues. Just for 1 second, Lauren, if you'll go to the next slide, I just want to show the other piece of this framework. This is the second piece of the framework, which is really understanding what caregivers need during COVID-19. And you'll see this bifurcation again in the blue, what caregivers need when they may be physically separated. And then in total, you add to that these two red boxes of what they need when they're living in the same place. So we recognize there's sort of a baseline need, regardless of where you and that person live. And then there may be additional needs if you live in the same home, and social and behavioral health considerations. So let's go back a slide. And what I want to do is open it up for folks to react or throw things or offer suggestions or thoughts or reactions.
Hey, Grace, do you have in here, you probably do, and I'm just not seeing it, isolation? You know, with COVID-19, there's this sense that you have to take care, you know, if you're taking care of people, you've got to, one, you now are greater risk to your care, to the patient, to your family members, if you're going out and about, but also the isolation of which I think we're all facing a little bit of.
Yeah, I think so we talk a little bit about that under social engagement, but I think isolation is definitely an area where that's a really good point. Lauren, I'm wondering if you can, if we can maybe make some notes on the slide itself and add isolation here under emotional support.
Yeah.
I think that's a good point.
And also concern that, and I don't know what you would call it, but you know, what I've heard from people, we have a woman in my neighborhood who I get to talk to every once in a while on my walks, and she talks to me about how she's a 90-year-old mom who needs help. And so her biggest concern is bringing, you know, as she's going out to do the shopping and all the things that she has to do, that sense of responsibility of keeping them safe. Does that make sense? Do you know what I mean? Not being the cause of bringing COVID into the house as they're trying to care for them, because they're such a vulnerable people.
Yeah, that's an interesting, how do we, yeah, I'm not sure how to phrase it, but I see what you're saying, that like, I don't, as the caregiver, want to, for example, go into my office and then come home and bring COVID home. Even if I might be okay, it might hurt the person I'm caring for.
And the stress, like you're going out, you know, I know nurses who are like literally sleeping in the basement, right, while they're working, because they don't want to risk their families and I know I have somebody else who takes her clothes off. She's in the dental office and she goes and swims, right? Anyway, that kind of that's got to, I live alone, but that's got to be overwhelming to feel so responsible.
I think that's good. So Lauren, let's add risk of contagion. And Mike from PHA, would you, you're welcome to chime in. I see you've got a comment here. I don't know if you want to elaborate on that.
Sure. Thank you, Grace. I was just chiming in to agree with the previous comment that in the PH community, most of our caregivers are co-resident, and there is this huge fear and guilt going on right now in our community of, you know, a lot of our co-resident caregivers are primary breadwinners, and so they feel they have to leave the home. And then at the end of the day, there's this huge fear of bringing the contagion back with them. So I'm really just repeating what was already said, but that's what we're getting a lot of questions and comments about in our support group networks and through direct communications from caregivers to us about what do I do? How do I keep my patient safe when I have to leave to, you know, protect us financially? But then when I come home, how do I protect us medically? Thank you.
That's great. So Lauren, if you want to add just in parentheses there, guilt and fear, for us to come back to, I think that's helpful. Other thoughts or comments about this initial framework?
Grace, this is Jadine Ransdell.
Hi, Jadine.
I had put in the chat box, I'm aware of at least one family. The brother lives in a group home, and the sister, isn't there. And he had an appointment with his gerontologist to do like care planning. And the sister was really torn on making an issue about going to the group home, which, they were in isolation at the time. She could not participate by Zoom, even though the doctor was going to be participating with the brother, a caregiver who doesn't know the brother as well. So there was a lot of stress that came into trying to figure out what was the best way to deal with it. And I don't know how she ended up dealing with it, but I know it wore on her for quite a bit, trying to figure out how to support her brother in this and they couldn't reschedule. I mean, there were just all kinds of roadblocks for doing a good job with this fellow. And so it was just too bad, because the doctor wouldn't allow more than one Zoom connection with them. And so so it's
Wow. Well, thank you for sharing that, Jadine. So Lauren, let's put gatekeeping dash electronic or electronic gatekeeping, because we have heard a lot about people being not being able to be present with someone physically, but I think that electronic gatekeeping, that's interesting. And I wonder if part of that is lack of education about just about HIPAA and some of those things. Eric Sokol from AFA, did you want to weigh in?
Am I off mute? Okay.
Yep.
Just wanted to bring up, in the dementia community, it's really families are concerned that their loved one might not recognize them if they're in a nursing facility and isolating as a result of COVID. Their dementia might progress, and after 2-3 months, whatever cognitive reserves might have been built up are no longer going to be there. So that's a concern. I don't know how we can address it, but I'm sure in other communities, isolation and that, you already have it written down in that box. Isolation is a big issue, but this is sort of a sub-issue of that, I guess.
Yeah, so Lauren, will you put cognitive impairment and then this issue of Eric, I don't know if you want to help me here a little bit. I'm thinking it's the lack of recognition, or sort of the loss of the family relationship.
Yeah, maybe a speed of cognitive decline. I don't know if that that might need some evidence base behind it, but just that perception that family members, what was once there might not be after months of isolation, and not having that constant reinforcement that this is X or Y. But again, I think that it's a subset, and it probably influences the dementia community more than most.
That's fascinating. One more comment. It looks like Dexter Allen from my team. Dex, did you have something you wanted to share?
Oh, yes. My mom is experiencing dementia, and one of the things I know we deal with isolation, to refrain from isolation as far as going out into stores. There's a program in DC that I just found out this weekend that my niece and my sisters, they order online from all stores, even BJ's, to deliver products to the home, because we can't leave her alone at all. So that's one way we keep from spreading the disease, spreading COVID-19, things like that. So that may be a resource in other cities or whatever to look into.
Well, yes. I'm just wondering if there's any way that we can, impose upon, people in nursing homes to take technology like FaceTime, but again, with staffing shortages, I don't know if we should recommend that because of the resources available are very limited, and the time needed for each patient might be a lot, but it's one way to stay in touch. And as Dexter mentioned, taking advantage of course, you know, all sorts of resources where we can avoid having to get out on the day-to-day basis is always a great thing. So.
Yeah, Caitlin Fitzsimmons from Anthem, did you want to weigh in on that? You and also Kristen Murphy?
Yeah. I was just, you know, thinking about how FaceTime, you know, like you said, could possibly make a difference here. But also one of the things that sprung to mind was Carely that you referred us to, and how was that communication between facility providers and families. And, you know, if there was a way to expand that to include a video component, because, you know, I agree that is a legitimate concern.
So let's add, Lauren, let's add down there sort of, you know, opportunities related to mobile technology and video tech. Kristen Murphy from Centene, did you want to weigh in?
Sure. I was just going to comment on the HCBS shortage bucket. I think there are two big aspects to it. Is one, the fear of somebody coming into the home. Because one, we don't know what they're doing in their home or what second job or third job that they're working, given low wages and trying to make ends meet. But also, I mean, and then there is simply the staffing shortage. So, I mean, there's a lot of things happening on the workforce side with changes in I guess, lessening of restrictions. So, I mean, that's positive, but I don't know what the future holds for that. The second component that I thought of, and certainly this could fall within finance or into another, I guess, food bucket, but looking at the increased cost for things like meat or fresh vegetables or even finding fresh vegetables. And then, you know, your staples like toilet paper. I mean, probably every single person on this call had a hard time finding toilet paper for how many months. And so now you've got a support person who's trying to kind of do double duty here, no pun intended, on, you know, really trying to find these resources. So, I mean, I think that's a critical component.
I think that's helpful. So Lauren, let's add a line just on workforce, both the shortage and the risk of contagion for workforce. And then on household security, so it's not just food, but also just, you know, household staples like cleaning supplies and things like that. So I think
cost, yeah.
And the cost, yeah, that's a good point. Yeah, it would the increased cost of, especially when we think about other economic pressures. Sue from Alliance from Aging Research, did you want to weigh in?
Yeah, I just wanted to share, I know early on, I think it was AARP started an interest group with the Administration on Community Living that a number of groups, I'm sure you guys are a part of that, you know, to convene every couple of weeks and discuss issues. And right from the get-go, there was a sentiment that, you know, for home and community-based services, family caregivers, local area agencies on aging, that those were all sort of local issues, should be handled at the local level. There wasn't going to be guidance at the federal level. PPE was something that had to be dealt with at the local level. Basically, kind of you're on your own, kiddos. And I think, you know, there's been a lot of focus on PPE for hospitals, you know, much less for like nursing homes, and even less for home and community-based services, including for family caregivers. And that's really key. I mean, to argue that family caregivers should be considered at the level of professional care agencies, you know, there's an argument to be made that there needs to be attention for them getting access to adequate PPE. And not necessarily like big face shields and big outfits and all that, but even just the basics like masks and gloves and getting guidance on handling medication management, personal care, all that. Those are really important, and kind of dealing with the psychological aspects of that, because people do get so afraid they're going to infect their loved ones. That there needs to be national guidance on those types of issues.
That's a great point. So Lauren, let's add PPE and safety training for caregivers. Kathy Cameron over at NCOA, did you want to weigh in on anything?
Sure. Thank you, Grace. Yeah, I just wanted to mention at NCOA, we work with senior centers, AAAs, state units on aging, departments of health that have traditionally implemented evidence-based community programs in person. Well, they've really pivoted over the last 2 months to offer many of these programs virtually. Some are offered, through Zoom, Facebook, some are offered over the phone. And I think caregivers can really benefit from these programs, and perhaps, some caregivers can participate with their care recipient, in some of the simple physical activity programs that are being offered, but also caregivers could probably benefit from some of the depression management programs like Healthy Ideas. So I just wanted to bring that up, and perhaps we can, talk about outreach, maybe through your coalitions, and also wanted to mention that, gosh, what was it, 2 or 3 years ago, we partnered and developed a conversation guide for caregivers around preventing falls. And I think during the pandemic is really an optimal time to have those conversations, particularly those who are, co-residing with their care recipient. I mean, there's a lot of great tools in that conversation guide for caregivers to use, such as, what simple things can be done to make the home safer during the pandemic, as we're, stuck at home, and we know most falls happen in the home.
Thanks, Kathy. Yeah, and that's a great point, because one of, we can't be all things to all people. We're a small but powerful team, but we are a small team. So, as each of your organizations have insight, resources that you'd like to offer, please send them to us, because that's something I think we'd like to fold in this as we start aggregating information. I know that we could talk about COVID all day, and I'm sure many of you have. I just want to get a chance to, if we could go to the next slide, Lauren. And Lauren, I see your hand is raised. I don't know if you had a final thought on this one before we transition to the next piece.
Yeah, I was just going to say, in regards to trying to keep in touch with loved ones that were isolated from, my grandpa's 98 and he still lives completely alone and not in a care facility at all, but he also doesn't have an iPhone or anything like that and wouldn't know the first thing about using it. So I've been recently looking, before the pandemic and COVID, technology companies had started coming out with video chatting devices and apps that were specifically for older people who weren't as into learning about technology, that are quite literally, you push a red button when the call comes up and you're the only one calling them. So I wonder if that could be utilized in order to help with COVID, especially since it's so important right now to keep in touch in that way.
If we could, before we leave this page where it says opportunities related to mobile tech and video tech, let's add virtual CBOs and community-based organization programs. And then Jadine, I'm just seeing a great comment here about, and this is sort of similar to what Eric had mentioned earlier from AFA, which is just the challenges related to as adult day centers close or schools close that normally provide support to kids with disabilities, that there is a loss of skills since the closure of those programs. And I think that's a major issue. So we're not going to have time to talk through this next slide. But what I want to do is say, so if we can go to the next slide on caregiver needs.
Well, it's just going to stay there.
It's, yeah, isn't Zoom fun? Gosh, okay. So caregiver needs. So what I would say to you is, if you're looking at this and you're like, wow, this is really interesting, I want to get more engaged, this is a great opportunity to join one of our working groups, because we're going to continue to work on this in partnership with many of the organizations on the line And we also welcome your feedback as you have it. Again, the idea here is to really identify the needs, spot the issues, as they used to say in law school, and then from there to pair that up with what resources currently exist that can be helpful. This is aligned with some of the other work that's happening and that some of you may have been engaged with, like looking at billing codes and the like. That can help provide support for families. So if you're interested, you can email me or you can email Lauren, and we'll get you engaged. So let's go to the next slide, Lauren. Next slide. And we had a little bit of a spirited discussion, and then let's go on to that last slide. With the last 6 minutes, we'd love to open it up if there's any other new or other business. The other thing I would just throw out there is if you're interested in doing a mission moment on one of our webinars, or you would like to share some of what you've been working on at your organization, we'd love to hear from you. So that's another option. If there's something that you'd love to sort of discuss with this group, or you have information you think would be helpful, we want to hear from you. So I'll open it up for the last 6 minutes if there's any thoughts, questions, or announcements that people would like to share.
Hey, Grace, Kathy Jackson, I don't have an announcement, but I really like how you knew we were going to have a spirited discussion. you put that adjective up there without even waiting. I love it.
Yeah, absolutely. Other announcements or feedback or questions from anyone?
This is a comment, Eric from AFA. I was guilty pleasure watching one of the Housewives or whatever stupid show on Bravo, and AARP had a caregiving 30-second spot. It was really excellent, gave 5 tips geared toward COVID, but certainly valid in any at any time. So I thought it was well done, and it was good to see that out there as a PSA.
Yeah, thank you, Eric. They actually, so AARP actually has a really robust site. It's aarp.org/coronavirus. And one of the tools they have is the opportunity to create a coronavirus preparedness plan for your family. So it's very cool that they're working on that. And those are exactly the kinds of things too that we're thinking about and looking for if you have those.
Good question.
Oh, go for it.
Okay. Sorry, I'm not following the Zoom rules. Just wondering if there are any things teed up at your organization based on the findings you've seen so far as it relates to COVID, that your sort of programs or resources or things that are at the top of your list as priorities that NAC will sort of push forward for development, or if we are in a stage of really fact finding and information gathering now and looking to groups to think through what might come out of some of this research.
Yeah, so Kathy Jackson, actually, her organization, Mallinckrodt, had supported a large set of programs you're doing around caregiving and unmet need. And part of that included some work to really identify what we're calling pathways. How do caregivers move through different pathways? So we've done a little bit of work with FDA. We were thrilled to see that the Cures 2.0 legislation specifically identifies caregiving as one of the pillars of innovation and understanding how caregivers fit in a medical product development. The second thing that we're working on sort of related to this is understanding how caregivers fit in, how they fit into delivery models. So like, what's the reimbursement mechanism? So we had an initial meeting in December, and we'll convene again this summer to put together a guidance sort of similar to what Charlotte presented for IBD, but that helps providers identify where can they get reimbursed for family support services. The two other areas that come to mind, our advocacy team is working on a 50-state strategy for caregiving coalitions and advocates, and that will have a gloss related to COVID-19. And then our tremendous research department is doing work around health equities. So our research study had oversamples for African American, Asian American, Latin American populations. And so we'll be working this fall to put out information related to that, both through a grant through one of our members, Amgen, and I see Dina and Kim were on the line, but also through partnership with the Diverse Elders Coalition and some of the work that they're doing related to listening sessions and understanding the need of diverse populations. And that's an area where I think COVID-19 is particularly relevant because of the disproportionate impact. Okay, well, all of you are fabulous. I hope you're staying safe at home and not getting too bored. I'm going to give you back 2 minutes so that you can run around your house before your next call, but our electronic doors are open, so please reach out to me, to Lauren, to Dex, to anyone on the team if you have questions, thoughts, or concerns, or ideas. Okay. Awesome, thank you guys.
Bye, thank you.
Lauren, you want to close this out?
Thank you, everybody, for joining us, and we look forward to continue communicating with you and speaking to you at the next member webinar, which will be in September, I believe.
Awesome. Thanks so much.